Hello there, wherever you are in the world. For those of us in Europe, good morning and a warm welcome to this eMHIC webinar. My name, for those of you who don't know me, is Fiona Costello, and it's my pleasure to be your host for today's chat entitled Towards a Digital Mental Health Ecosystem, Designing Meaningful User Journeys in Denmark. This webinar is about the exciting development of Denmark's new digital mental health ecosystem, a project commissioned by the Danish government. At the heart of this initiative is a groundbreaking self-help wellbeing platform that offers valuable resources, tools, and signposting to mental health supports. The team at the Centre for Digital Psychiatry will take us behind the scenes, sharing how extensive user research and iterative design have shaped this platform. We'll explore the UX and UI strategies and content design that encourage users to engage with the platform, fostering self-awareness and nudging them towards help-seeking behaviours. You will hear from each of our speakers soon, but as always, I have a few quick points to mention. Firstly, for those of you who are joining us, feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose edit, and add your country or area. This allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, please feel free to post them in the chat box, which is the Q&A box, not the chat, the Q&A box. During the Q&A session, I will do my best to include as many of them as possible in our discussion. And lastly, as always, today's webinar is being recorded and the eMHIC team will soon share the recording in the Knowledge Bank. So now it gives me great pleasure to introduce the first speaker, Marie Paden-Folker, who some of you may have met or seen at last year's Congress in Canada. Marie is the Managing Director of the Centre for Digital Psychiatry, an anthropologist and expert digital mental health innovator and practitioner. Marie has worked in the digital health field for over 15 years, specialising in digital mental health. At the Centre for Digital Psychiatry, Marie is responsible for the development and implementation of digital mental health interventions with regional and national reach. Marie is now going to provide us with an introduction to the Centre for Digital Psychiatry and some context on this exciting new project commissioned by the Danish government, which is now well and truly underway, designing the Danish digital mental health ecosystem. Welcome, Marie. It's lovely for you to join us this morning, this afternoon, this evening. Over to you.
Thank you so much, Fiona. Hello, everyone. Thank you for the kind introduction and the invitation to be in this webinar, sharing our experiences. So I will start out just by providing you with a very brief introduction to the Center for Digital Psychiatry, the work we do in Denmark, and the situation concerning mental health in Denmark. So very briefly, a Center for Digital Psychiatry, we are part of a university mental health hospital in the region of southern Denmark. We were established as a center 10 years ago to address the shortage of mental health care professionals and the growing mental health crisis. So how can we use digital technologies to improve access to care? How can we use digital to improve outcomes for people with mental health disorders? These are the central questions that the center's work revolves around. So today the mission of the center is really to develop and to scale evidence-based digital solutions to promote mental health, as well as to prevent, assess, and treat mental illness. So we work collaboratively with service users in everything that we do, with young people, with adults, with their relatives, families, with mental health care professionals in developing and implementing digital services. We haven't solved the mental health crisis in Denmark yet. And in Denmark, mental health indeed is a national public health priority. So mental health conditions in Denmark are prevalent in Denmark as well as in the Nordic countries, according to recent statistics from the OECD. So 17 to 19% of the population in the Nordic countries have a mental health disorder. We also see a significant increase in youth in mental health problems among young people, such as anxiety, depression, stress. In Denmark, 1 in 3 young people reports signs of poor mental well-being. And many young people face long waiting times for mental health care, underlining the need for low threshold support, early support. In Denmark, we have a huge debate about the main causes behind this development in mental health. There is, in youth mental health, there's a much speculation, much disagreement. Is the youth mental health crisis, is it real, or do we create it by talking so much about it? And this discussion, I think, is very important, but it's also important to realize the consequences of in terms of poor mental health, in terms of reduced quality of life, of reduced access to education and job and labor market for young people. And these consequences are very, very real. So taken together, poor mental health and mental health disorders have enormous economic and social consequences to the individual as well as to society. It also comes with pressure on the system. So in the last 10 years in Denmark, we have seen a 50% increase in patients in child and adolescent psychiatry. And in the adult mental health services, it's a 25% increase over the last 10 years. So we do not only know the problems, we also know a lot of the contributing factors that make these problems worse. And one of these factors is a very complex mental health care system. So knowing where one sector ends and another begins, and how to coordinate different disciplines is difficult even for mental health care specialists, to say the least, for citizens. So for people with complex mental health disorders, it's extremely difficult to navigate the system and find the right help at the right time. So we have at the center a recent ethnographic study where a woman with bipolar disorder, she described the time after hospital discharge like this. It's like being put in a car, blindfolded, and then suddenly thrown out without a GPS. So in Denmark, system complexity is further complicated by lack of coordinated legislation, lack of common standards across sectors and disciplines. And then in addition, we have problems with capacity. So for years, it has been a major challenge to recruit and retain staff, not only in the specialized services, but also in the local services and in the municipalities in Denmark. So digital mental health interventions have emerged in Denmark over the last decade as a promising response to the treatment gap, to the waiting times, the fragmented user journeys. So leveraging technology to deliver low-cost, effective, and always accessible mental health services at scale. And at Center for Digital Psychiatry, that's where we are. We try to build mental health services in a stepped care model, where you provide evidence-based, curated information, self-help tools, and guidance to the entire population. So allowing people to help themselves with the lowest level of professional intensity involvement, thus freeing up resources for people who need closer contact in the mental health services. And very briefly, we have already a set of building blocks of what we try to call a future mental health ecosystem. We have MindHelper. I'll just go very briefly over them, and then we will go into detail with one of our new services. So MindHelper is Denmark's most comprehensive youth mental well-being service designed for and with young people. So MindHelper offers young people evidence-based information, self-help tools, and navigation and guidance for life problems, and navigation to further help. We also have Internetpsykiatrien, and Internetpsykiatrien is our national digital mental health service, providing guided therapy for internet-based therapy for mild to moderate depression and anxiety to the adult populations. So it's a self-referral service with 12 weeks of psychological guided therapy. It's a free digital mental health service to the adult population across the country, funded by the regions and the government. Then we have MindApps. MindApps is an app assessment service guiding patients and clinicians in selecting safe and effective apps. This service is in the process of being scaled nationally as a national app accreditation service in Denmark. And then recently we've been commissioned by the government in Denmark to build a new digital well-being platform for the adult population. And this well-being platform will be offering information, self-help, navigation to evidence-based content and mental health resources. We've also been commissioned to build the first ever purpose-built IT infrastructure for delivering digital psychological therapies at scale. Perhaps we'll return to that initiative in the panel discussion, but for now, we will go into detail with the latest addition to our building blocks, that is the well-being platform. And my colleague Thor Juhl Groth will go into this part of the webinar.
Thank you, Marie. I'm now going to attempt to say Thor's name and give it justice. So Thor Ulkruth is the head of communications and engagement strategy at the Centre for Digital Psychiatry and the project lead of a new online self-help platform for adult Danes. For 4 years, he has contributed to Internet Psychiatrien's communications strategy, web design, and user engagement. Thor is now going to give a presentation on the development of a new national wellbeing service in Denmark, the methodology, insights, and design principles so far. Welcome. Thank you for joining us. Over to you.
Yes, thank you so much, Fiona. And thank you everybody for being here today. Every time I'm in a room like this, it feels like coming home, because it's sometimes a little lonely working with digital mental health, but when we meet up like this, it's so meaningful. Yes, I've been working at the center for the last 4 years. Before that, in total of 15 years in mental health services, public, private, and NGO. But the last 1.5 year, I've been leading this wellbeing platform that I'll present to you today. And for me, this is so meaningful work, because I have now learned how we can use digital treatment and digital self-help content to press for a much more general cultural change, at least in Denmark, of making self-care a habit for all of us. For my brief talk here, I'll take you through some different things. I'll try to explain the why of the platform. Why are we doing this? What have we set out to deliver? Then I'll go over some key functionalities and user journeys on the platform, and I'll try to share some key learnings we have had so far. And then I hope to end up with some potentials for the future and some questions for you guys. I really hope to learn from this talk as well. Well, there is perhaps not so inspiring political why that has started the work on this platform. And the political why is we want to deliver digital self-help programs in the same scale as comparable countries. We see that unguided self-help is delivered in other countries, and Marie and other people inspired the politicians to make this a Danish ambition. So this new platform will not be delivering treatment, but unguided self-help programs and self-help content for adults struggling with mental health. And of course, the basic premise is that online self-help content has massive scalability. The perhaps a little more exciting why is our design why. When we try to grasp this task, we really aim to make high quality self-help easily accessible to all adult Danes for whom it's relevant. And when we break that down to a design task, we see it, the basic task, as being connecting the right user with the right help at the right time in her life. So this is not a simple task. There are many difficulties on the path to making that happen. And I'll try to talk about some of them. And then I really look forward to you asking into it and sharing your insights. A brief status of the project. As you heard, it's work in progress. We have done more than a year of user research, concept design, and user testing by now. And thus we are currently maturing the final design concepts and translating them to requirement specifications for the technical development. And this development phase will take up most of 2025. And this will be both technical and content development. And we reached an essential milestone this winter, which I think will be interesting to this group. We have this fall tested and now agreed upon a rather unique partnership. In Denmark, there's a part of the public sector, an organization called sundhed.dk, which is basically health.dk, but in Danish. And they have a publicly accessible platform, which is, we in the Danish health sector aspire to making the digital front door to the health sector. But if we are honest, it's mainly a platform people are using to access their health data and health information. But now with this project, the government and we and health.dk aspire to create take an important step further with regards to making it a real digital front door for health services by making this new platform a key component of health.dk, sundhed.dk, and delivering self-help services there. So on this digital platform, of course, a key functionality will be delivering freely available, user-friendly and engaging self-help programs at scale. But that's only, at least mainly, a technical task. What we have experienced in our user research and user testing is that many adults Danes are not ready to help themselves. And it's quite a barrier we have to work with when designing this platform. They often can't quite tell what they are experiencing when they are struggling. They know they are not feeling well, but is it anxiety? Is it stress? Is it something else? They don't even have the language to say for themselves what it is often. And often they don't know why they are experiencing it as well. And thus we have now made it a design principle on this platform that many of the key user journeys on the platform will not only be navigation, but always a combination of personal reflection, assisting the user in engaging with personal reflection and navigation at the same time. So making them reflect upon the situation, making a choice, thus navigating further, and then navigating towards relevant content. We expect the platform to have two main pathways to self-help content. One, I bet many of you know, is via search engines, often Google, where we know that from MindHelper, from internetpsykiatrien.dk and other online platforms we know that the users will come via search engines with a very specific purpose, and they will start their user journey on a very specific subsite. So there we will deliver whatever they are looking for, informed by our user research. For example, assistance in sleeping better, or assistance in having a better relationship with my partner, or assistance with having a better relationship with my children, or assistance in working with my personal anxiety. Another key pathway, but perhaps not the main pathway in volume, will be the front page. And this front page of the platform we are designing specifically for the use case of these unclear people who don't really know what's happening with them and why they are struggling, but they have perhaps joined this page via a recommendation from a friend, family member, the GP, or another professional. And here we make these highly very curated pathways for the patient to person to get to know themselves, their own situation, and develop an understanding of why they are there and what help could be relevant for them. And then, of course, a third key pathway will be for the experienced user. There will be a content library with self-help programs and other content, almost like a streaming service if you look at it from functionality. As you probably gather from this presentation of the platform, we have done some key learnings so far that have been fundamental for the design that we are now developing. We have learned from our user research that many adult Danes are not used to reflecting upon their own experience of well-being, discomfort, or mental struggles. They simply aren't. We have a culture where we tend to press on until we have to call in sick, and then maybe we get help in that situation. But we don't have a tradition and a culture of reflecting. We don't even have a proper language for talking about mental health struggles or struggling with well-being that is not illness before it is illness. So we have a language which is very centered about diagnosis. And this is a cultural challenge, which I predict will be our main challenge when the platform is developed. We want to use these easily available digital resources as an important tool in changing that culture and driving change and starting new conversations about when and how you can get help. Luckily, we found out in our user research that well-being, everyday life, personal relationships, they provide a language and a universe that the adult Danes are comfortable engaging with when experiencing mental health struggles. Much more than if we start talking about mental health or mental illness. But if we engage with them in a de-escalating, rather casual, easily accessible tone of voice, and let's focus on their everyday life and their personal relationships, they are actually prepared to engage with us with regards to self-help. For example, we will use illustrations rather than pictures on the platform, since we have learned from our research that they are much more relatable for the platform's users. They are also de-escalating. So a well-being platform, in our experience, is a rather unique homepage format. But one of the great chances and something we have experienced is a opportunity for us is that when we present ourselves, and also in earlier designs, but especially also when we present ourselves via the Sundhed.dk, the health.dk identity, the users, they really trust us. In Denmark, there's a trust in healthcare providers. And thus, we have learned that the users, they prefer a user experience that's much more gourmet rather than buffet, as we say. They want to be presented with the few correct options for action that we recommend them, rather than a buffet of 5, 10, 20 possibilities, because this is just too much. They can't handle so many options in this situation. Some would say that modern users online can't handle that many options in any case, but our users definitely can't. So we have an essential task when also both designing the functionalities of the platform, but also creating the content, to be very aware on each subsite, who will be here, what are they reflecting upon, and what few options, 2, 3 options would be attractive for them to be presented with. Yeah, I think that will do for now, and I really look forward to hearing your questions and comments. If I should just reflect upon the potentials for the futures and the questions I have for you, it seems to me that these simple, accessible, interconnected user journeys are so essential for a platform like this to be essential. Thus, the possibilities are almost endless with regards to connecting relevant services to make the experience even more user-friendly. And I also think of both online and offline services. So I'm very curious about all your experiences in this area. In my experience, it's really almost a battle from building to building to get to connect with all the relevant gatekeepers and hook up with all the relevant partners. Also, if you have experience working with this culture, in Denmark, we almost have a culture against self-help seeking and self-help. But if you have any experience using digital interventions and perhaps campaigns or promotion about digital interventions to work with this culture, I would also be very interested in sharing those. Yeah, perhaps this will be my talk for now.
Thank you so much, Tor. So insightful. I know I have questions, and I am sure the audience has questions. So I would encourage you all to start asking in the Q&A box. But I would now like to introduce all of our speakers back to the floor. Included in the panel discussion is now Thomas Lambertsen-Binzer. Thomas is the Chief Technology Officer at the Centre for Digital Psychiatry and has been part of the centre for 7 years. Thomas and the technology and data team primarily work on the development of digital therapy programs and the IT systems needed to deliver digital treatment. He also works with the application of new technologies in psychiatric care and is part of Region Southern Denmark's steering group for artificial intelligence. So, welcome back to all of you, and welcome, Thomas. It's a pleasure for you to join us, I'm sure. Let's dive in. Again, just a very quick reminder to drop the questions in the Q&A box, please, to the audience, and I'll bring them into the discussion, prioritizing those questions. But I think for me, I just wanted to, first of all, I wanted to sort of reflect on what you were just saying, Tor, about language and about how people resonate with specific terms. And I think, Marie, it starts to touch upon what you were talking about in sort of what we would deem almost like over-pathologizing normal feelings. And so, but also at the same time, not making people feel uncomfortable to the point that they don't want to get help. Anecdotally, I know, for example, this is important because a little while back, we did a webinar looking at people with autism and specific technologies, and stress, quote unquote, did not mean anything to them. They didn't know what it is to be stressed. So I'm really curious as to how you have sort of factored that in terms of your user engagement to date and what sort of findings you found.
Yes, we have done extensive user research. We started off with a lot, 20 deep dive, 30 actually in total deep dive interviews with people who have participated in a quantitative study we made, just to get a view of the landscape, so to speak. How do the Danes themselves perceive and talk about their mental health struggles, and what are the most common ones? And that gave us the foundation to start prototyping and concept work. And it has really been quite the journey. We as I told in my talk, there is one essential finding was this: instead of talking, we can't even say mental health actually, because many people they shut down and say, no, this is not for me. I don't feel well. It's not mental health. So we don't even, I think the platform won't mention mental health as such, and it will talk about well-being. And as I said, people's everyday life, themes like sleep, family life, work life, and such will be the hooks that we use to start a conversation with people. And then we will make sure to guide them through these reflections. And then, at least in our rather extensive user testing, when we do that, and we do it rather curated, and as I say, we really take an active role in setting the scene during these user journeys. We can help them from where maybe I don't sleep so well, and through some interactions and some pieces of content, we have now proven, at least in our user research, that at some point during such a user journey, we can make it attractive for them to engage in a self-help program, which is more like these online self-help resources that are in format are similar to e-learning, but where I use perhaps several weeks to work with my anxiety or experiences of anxiety. And we know that if we put that program in the face of our user, this unclear user, on the front page, she won't engage. But we know now that if we curate reflections and curate her journey towards getting a language and thinking about why is this happening to me, we can actually make it attractive for her. Then actually many of the users are, wow, a whole program. Can I join the program now? Is it free? But that's definitely not the reaction at the beginning. I don't know if
Yeah, I
that
can
was an answer.
imagine. Yeah, no, absolutely. I think it's, I think what you're talking about is people, people's stories acting as the point of, and that sort of lived and living experience of different circumstances and different challenges, being able to then help people to resonate and then think, oh, actually, maybe I can get something from this, is what I've taken from what you just said. Marie, I guess it's a similar thing in terms of the language and that sort of that bridge also to clinicians and kind of how you create this ecosystem that enables those bridges, but also allows the system to have the right mechanisms in place so that people know when they really do need to get help above and beyond self-help. Could you talk a little bit about that?
Well, yes, of course. This is also, I guess, Tor, you mentioned work in progress, because I think the findings that we are doing right now on the wellbeing platform relating to this lack of language, it's also and lack of a non-existent culture for self-help. I think that's what we are actually struggling with in Denmark, because in Denmark we have, as I also mentioned in the beginning, we have a rather elaborate help system for people with disorders, and our work is not about like diminishing, of course, the reality when you do have a diagnosis. So we really, the work ahead of us right now is to forge those building to forge these bridges to the GPs, for instance, which are the first line of contact in Denmark before having this well-being service. I think the greatest risk is that our well-being service would be kind of siloed, not connected to the established system. But this is work ahead of us right now. We also in Denmark have an initiative on a digital front door. We have a health reform in Denmark where this digital front door concept or vision about creating a digital front door is part of the reform process. It has not been realized yet. It's only on the discussing level, but I guess pointing towards the early steps of the step care model is what we do with the well-being service right now. And this is very important because we cannot really provide adequate help to the citizens of Denmark if we only think in the contact face-to-face based services. But it's really, you said it too, it's like a battle from door to door, or it's a discussion that we need to engage in now, and that we are engaging in at the moment. Yeah.
In terms of, thanks, Maria. In terms of the ingredients of a successful digital mental health ecosystem, and I think this applies to digital overall, as I was thinking about today's panel, what I was wondering about is how you create those channels for engagement and how you sustain that engagement. So we can obviously talk about it, and in principle, as professionals who work in this environment, we instinctively and intuitively understand the value. But how do you sustain that to a general population? Could you talk a little bit about what you're thinking in terms of communication and engagement strategies to continue to optimize this project and to kind of really bring Danes on this journey with you?
Yes, I've also, as I mentioned, worked with scaling the internet psychiatry, the treatment offer. So we also have a lot of experience from there that I draw upon when now. We attempt to be have as much humility and curiosity, because in our experience, the key thing is for us to be where the users are, for us to be where the patients are. And I would highlight two key arenas for that. The one is one Marie mentioned. For us in Denmark, the GPs, this is where many people come when they struggle. So it is essential for us to be top of mind for as many GPs and other health professionals as possible. And we do a lot of work with such boring things as posters and postcards and promoting the treatment possibilities, because in our experience, it helps the GP during her job, making it easy to promote. The other area I would highlight, which is competing with GPs as our main source of attention, is search engines online. And there we have actually, in my humble opinion, we are starting to work very sophisticated with that, because we can see we have to be very specific in using or identifying the language and the life situation of the searching person for us to be relevant for them. So we built our website and the promotion of our services from the beginning with a special attention to the language and the demand from the search engines, because they are kind of a live users research engine. Where are people? What are they talking about? How are they talking about it? And what are they ready for us to help them with? And then we will try to push the services that we think we deem the right ones into the conversations where we see a fit.
Thank you. I'm going to take this opportunity to start asking some of the questions that are coming through from the audience, rather than monopolizing this discussion. One of the things I think, picking up just very quickly on your point there, Heidi has asked your comment regarding the lack of language to describe mental health. We undertook a discovery of mental health services in NHS Wales. One of the findings is the stigma of mental health in some ethnic groups that exist. There are no words in their first language to describe mental health. How, when you're thinking about what people are searching, and I know you've mentioned sort of, things like sleep, like family life, self-help programs, when people are not comfortable in exploring that side of them, that sort of even language to sort of indicate that they might need help with family life, how do you overcome that sort of stigma with language, or how do you create an environment that's empowering? So I know you talked a little bit about personal stories. In terms of ethnicity and cultural sensitivities, is that a similar kind of profiling exercise?
In Denmark, we are a rather homogenic society. So we have our the people in the country of Greenland, and the people in the Faroe Islands are part of the Danish kingdom, but they are not such large populations. We have translated the Mindhelper platform to Greenlandic, for example. But in my experience and what I've heard from that endeavor is that it's actually still the same basic task that I've described thus far, being very humble and curious about where are people when they feel this struggle or they feel this discomfort, because people will feel the struggle or discomfort, and it will present itself in their life in a way that they experience and to some degree talk about. I think we have to, for many users, minorities or majorities, we have to stop talking about mental health actually, and just talk about what their experiences is. I can't sleep. I'm constantly arguing with my spouse or my boss or my colleague or whoever, and start engaging in those conversations. And then we can start the user journeys I described from the wellbeing platform.
Thanks, Tor. And what about different age groups? I know that you've talked quite a lot about, Marie, certainly you started by sort of reflecting on sort of the significant uptake in child and adolescent reported concerns with their mental health and well-being. How is that factoring into the design and development?
It is a major challenge because we have this fundamental design principle now, which we see as essential, that we have to be de-escalating everyday life, easily accessible. But it's different to different people what that is, and especially to different age groups. So the young adults, they want us swearing, and they want a different tone. And then in the other end, we also really want to serve the aging population. They are very digital in Denmark. But if we go to them with that tone, they will be out of the door immediately. They find it disrespectful. So we don't design our content in specific age groups. We design it in life domains. And there will be life domains that especially are part of the younger adult life. And then we will have a domain which is especially for the elderly population. And we will use these domains to calibrate our tone of voice for the different target groups.
But of course,
Marie,
we've
have you
been
got anything to
discussing
add? Sorry, Marie, have you got anything to add on that?
I was just saying that we've been discussing this a lot, because it's a question we often get. So what about the older population? Will they feel supported through this service? And I guess, well, yes, we're trying to solve it as you just described it, but also recognizing that, of course, this it's not going to be a service for every citizen in Denmark. So, and then again, of course, also the wellbeing services is not the only entry point for receiving help. So it will be a complementary service to face-to-face services, and older people might still prefer to go to their GP, and they should continue doing so. Yeah.
So it's not about replacing existing mechanisms, but rather enhancing. Do you in Denmark, from a demographic perspective, have an aging population?
Oh, yes.
Yeah, okay. Because I think that it's very, very interesting. Chris Wright from Scotland did some really interesting research about how the differences between different age groups and how they engage. And I think that from memory, and the reason why I remember it is because I was working for SilverCloud at the time, and young people actually respond better to much more sort of communication based, which would make sense, when you think about the chat sort of elements of videos on TikTok and Instagram and whatnot. Whereas older people actually, in this research, found much more benefit from very structured, if I do this, this, and this, I will feel like that. But I am interested in terms of coming back to that comms and engagement side and the engagement, how you're kind of combining different engagement strategies. So, for example, for younger people, would you be thinking more about social media, for example?
Yeah, to some degree we do, but actually for younger people, we see our key source of traffic still being search engines. Then you could perhaps talk of YouTube as a search engine. And it's also because of the format. In a search engine, you are looking for something, a knowledge or options to act. And therefore we see this traffic as very relevant to our platforms. We also want to provide pieces of content on social media, but in my opinion, we haven't found a great strategy for this. And I could even think of a world where the best way of us to use social media is just to push the well-being content itself on the social media and seeing that as the relevant action. Here is a breathing exercise. Enjoy if you feel like it, and that's it. Yeah. Also, with regards to content on the platform, we see in Denmark the media trend. There has been an accelerated media trend, as I think is a global phenomenon, towards video and audio. And we take this very seriously, designing this platform. And we see it as relevant to all age groups, actually, because people simply just consume a lot of digital media in all ages. But we try to build content now which has all options: a brief video option, a text-based option, and an audio option, which is basically the same content as the text option. And then we see it as a task for our editors to evaluate this piece of content. What will be the main mode of consumption for most people? Is it video? Is it text? Is it sound? If I'm getting an exercise for sleeping at night, I don't want to read a blue screen. I want sound. So designing like that.
Yeah, I mean, I have so many more questions to ask, but I'm going to go back to the Q&A box for the front of the audience. Nina, hello, Nina. Nina has asked, you mentioned that you chose fewer rather than multiple options for users' self-help. How do you make those choices? What self-help tools did you end up choosing for your wellbeing platform?
I think what I meant when I said it, and we do choose rather few, but what is when on each page on the online platform, each sub page, the front page, and all these user journeys, we try on each page to give the user as few options as possible. That's actually a design goal for us. As few, if there's only 2 good options, and we would really love it for that to be so, then we only deliver those 2. Perhaps I have clicked on a subpage about stress at work, and I've made another decision. It's about work-life balance. We don't want to provide that user with 10 options. We want to provide her with perhaps 2 options. One she can use quickly now, and one which will be relevant self-help that she can work with for a longer while. But we do also, at least for this first version of the platform, don't develop so many self-help programs, and this decision will be solely informed by our user research. We did this analysis about a year ago. How are the adult Danes doing? What are they seeking help for? This will enlighten our work, and we will aim at delivering where there's a lot of demand in this first version. And we enlighten this further with the Google research to ensure that the content presents itself in a relevant way to the users.
Thank you, Tor. Hopefully that's answered your question, Nina. Nina also said, thanks a lot for your great presentations. I've now got a question from Kelly. Is your wellbeing platform covers all mental health issues? What about addiction, gambling, harm too? How do you engage with those young people, as Marie mentioned, that, well, I think we've covered that, but actually, how the diverse background people have been supported. We've talked about the challenge, like the sort of the very specific demographic context in Denmark. So I think, yeah, what about addiction and gambling harm?
Not in the current version. I think not. But we have a large RCT study of digital intervention in alcohol addiction. We are testing currently, but it's not in the current service design. But they are very relevant. We really just go where the demand is for now, because we want to make you could call it an MVP, minimum viable product. We want to show that the platform works, and we want to deliver content where the greatest demand is. And then we have a great ambition of adding more and more themes and function and themes of content on the platform. And definitely addiction and gambling and self-harm and such are relevant themes.
And just with that in mind, is it the intention, and you may be doing this already, but is it the intention to have some kind of public and patient engagement council that will be advising on the development of content for the platform and continuing to input into that iterative development?
Sorry, a council of whom? Sorry.
Sort of citizens, I suppose, like citizen engagement and a sort of a formal mechanism or a way of feeding back to kind of drive the development of this resource.
Yes, we do definitely have councils like that, but in my opinion, this I guess is a professional opinion. when developing this type of content, it's really relevant to most of us, or it has to be to some degree relevant to most of us, because most of us will experience all these struggles within this well-being realm. So often I prefer user testing with new users who represent the broader population. That's at least a very relevant criterion that we have to develop content that's relevant to most of us. I definitely agree with Marie that a platform like this is not for everybody, but it has to be for most of us. And if we developed, if the front page of this platform was with very specific content targeted to people with addiction and gambling problems, we would lose a lot of our users because they couldn't see themselves in this content, in my opinion.
I think, yeah, I think what you're talking about is the importance again. I think a lot of this is really about language and framing that really resonates with the vast majority, thinking about early intervention and prevention and how that can then amplify to sort of develop this culture of self-care. Tor, it would be really helpful if you could share some of the analysis that you're referring to. What we'll do is we'll get the chat afterwards. If people want to leave their email addresses and so on, I think Olivia actually already has them. But just in case, and then we can make sure that we're sharing all relevant information. I've just got one question. You talked about sort of how you're using search engines, and you talk about kind of that personal reflection exercise as well. So I guess my question around the personal reflection is, what does that look like? And my second question from a technology perspective is that you know, the more sophisticated we're becoming in terms of search engines and the more sophisticated we're becoming in the use of AI, for example, how can AI drive those personalized pathways for people? And has that factored into your thinking, and is the plan for that to factor into your thinking?
Complex questions, but I will start. With the. We have actually designed a very simple component for the website that we called. Right now, it's called an interactive guide, and that component will be essential in our view. And it's rather curious. It's a box with questions. Perhaps you, Fiona, has chosen. I want to look on content about work and work life. On the front page, you are then presented with, this will be one of the key components, this interactive guide. And it will, maybe I should use me as an example instead. Then the guide will ask me, so Tor, what's up? Are you stressed about your boss, about work-life balance, about colleagues, about not having a job? And then I'll answer one of these. And then from that interaction, the platform will start presenting me with relevant content, 2 or 3 pieces of content. And it will also present me with further questions down this line. Okay, you said it was about work-life balance. Do you have trouble sleeping? Yes. Then the content will arrange itself. Perhaps one will stay and 2 new will present themselves. In our user research, this very simple filter gives many users this extraordinary experience of a very personalized experience. The people are like, wow, this is my content. You really understand me. You asked me these important questions and I answered them. And now you provide me with this content that is so relevant to me. So actually, it's perhaps a bit of a and not spicy take. But I think we are way better off, for now at least, with this than with AI. In all AI designs I've seen so far, they are unpredictable and unreliable. We've heard that from partners in Australia. I saw a recent BBC study that if the big language models are tasked with providing public service content, they fail half the time. That would simply not be acceptable on this platform either.
Yeah, I can just follow up on that from a technology perspective. The AI systems that we currently have is not sufficient for doing these tasks, and I think there are other ways, like Tor just explained, that we can give the same sort of experience in a much more curated way, where it still feels very engaging. So that's what we're aiming for on this side. But obviously, it's something that we're testing. We have a lot of other projects at our center for looking at different AI solutions for targeting different problems, and that's definitely something that we're very interested in. But we're following that closely, and when we're ready, we will introduce those technologies into our different services, I think.
And I have no doubts that everybody, including those on the webinar, but also those who will rewatch this webinar, will be watching you and the team in Denmark, waiting to see what you do and following your best practice lead. We are about to close the webinar with a few minutes, but just as a sort of a way of summarizing, for me, what you've described is meeting people where they are, rather than asking people to be uncomfortable and, you know, reinforcing potential concepts around stigmatizing mental health. You're talking to them in a language that they understand. You're talking about family life, work life, all things that we can really easily resonate with, but we don't necessarily want to apply that additional layer of mental health and well-being. I cannot imagine what a challenge it is trying to reconcile the different needs of different users across the population, and reconciling neurodiversity with then age and then different preferences about how to receive information. But it sounds like some of the strategies that you've put in place around thinking about how do we create that really warm and welcoming environment that allows people to kind of have that bit of personal reflection, to think, what is it that's making me want to visit this website today, and then choose and select and then dig down, but in a gentle way that doesn't feel confronting. Sounds like a really good approach, whilst also simultaneously responding to people who have come to the site with a specific purpose and who are able to have that sort of that mental health and well-being literacy that enables them to do deep dives on specific content. We are increasingly talking about systems navigation, and I think at the heart of systems navigation, particularly in the context of mental health, was summed up by that quote, which was being put in a car blindfolded and then put out without GPS. I think we could all resonate with that if we're, as I am, slightly addicted actually to the blue dot on my iPhone telling me where I am and then trying to figure out which direction to go to. I think it's just, again, a way of meeting people where they are in terms of language. A huge thank you to each of our panelists, Marie, Tor, and Thomas. I hope that by some small way we did justice to this huge project that should act as global best practice. Thank you so much for your participation and engagement. Thank you to the audience for questions. I know that there have been numerous chats about signposting to different systems and eco groups, different ecosystems that people can latch into for best practice. So thank you for sharing that information. Very grateful, as always, to be joined by you all today. Have a wonderful day or evening ahead wherever you are in the world, and we will see you next time. Thank you so much.
Thank you.